Doctor, you mentioned an artificial disc prosthesis? Yes, I did. And if the spine is otherwise healthy, an artificial disc replacement may be inserted. Is that not true? Yes, it is, during an operation. And that is the anterior lumbar discectomy? That is correct, the interior lumbar discectomy. Is that to remove a disc in the lower lumbar region, doctor? It is an incision which is made in the lower abdomen and the abdominal contents moved to one side. Does the surgeon move the large blood vessels also? Yes, covering the spine out of the way to expose the lower lumbar vertebrae. Doctor, the herniated disc is then removed, is it not? The disc space is cleaned. And is it not true that an artificial disc prosthesis is inserted? Well, a similar procedure can be carried out in the neck to insert an artificial cervical disc. Doctor, let me ask you about microdiscectomy. Yes, microdiscectomy, correct. What is microdiscectomy? Microdiscectomy, or microsurgery, is performed through a small 1 inch to 1.5 inch opening. That is an incision over the spine, is it? Yes, it is. Doctor, the erector spinae muscles are moved to one side and the surgeon enters the spinal canal by removing a membrane. Is that not true? Yes, the ligamentum ileum. Does that cover the spinal nerve roots? Yes, it does. Using an operating microscope or special magnifying glass or loop, the surgeon removes a small part of one of the facet joints between two vertebrae. Is that in order to relieve, doctor, pressure over the nerve? Yes. And the nerve root, doctor, is then gently moved to one side and the part of the intervertebral disc pressing on it is cut away? Defense counsel, I object, Your Honor, to the form. The court, the objection is sustained. Doctor, let me ask you this. This procedure does not remove the laminate? No, it does not. Does this procedure be effective for treating leg pain? No, it is not. That is radiculopathy. Due to what, doctor? Due to a disc pressing on a lumbar nerve root. Is that rather than back pain? Well, it can be performed as a day case or with just one overnight stay in the hospital. Doctor, let me show you this photograph which shows a surgeon using saline solution to wash away blood and improve vision during spinal surgery. Yes, I see that. Does the surgeon identify with the correct laminae? Yes, the surgeon will identify the correct laminae to remove by counting down the vertebrae from a fixed point or taking an intraoperative x-ray. Doctor, the surgeon nibbles away at the laminae to be removed using a variety of special bone cutters. Is that not true? If performing a discectomy, very little bone needs to be removed to expose the part of the disc to be cut away. And, doctor, if performing an operation to decompress the spine, for example, because of narrowing from osteoarthritis or a tumor, a lot of bone may need to be removed. Is that not so? Well, the surgeon may excise the spinous process in the center of the vertebral arch, as well as the laminae on either side. Doctor, does he or she also trim the underside of the facet joints? Yes, that is true, between the vertebrae to give the nerve roots room to breathe. And removing damaged tissue is an important element of the operation? Yes, it is. The surgeon clears away any bone fragments that are pressing on the nerve root For example, osteophytes, which are small bony outgrowths that can develop as part of osteoarthritis, and may also remove a membrane, the ligamentum flavum, that covers the nerve root. Now, doctor, let me ask you this. If removal into the spinal canal, the outer coat or annulus fibrosus is cut and the inner nucleus pulposus is removed, in simple cases, what is the result? In simple cases, this procedure, or discectomy, can be carried out on its own using new, minimally invasive techniques without the need for laminectomy. And doctor, if a lot of bone is removed from the spine, it may become unstable. Is that true? The surgeon may therefore carry out a spinal fusion.
That's pretty good.